COVID-19 cases in the country remain on an upward trend as the government struggles to trace contacts of those who have tested positive. Data by the Kenya Medical Research Institute, KEMRI, suggest that more than 2.6 million Kenyans may have been exposed to the virus. We now want to debunk some of this issue surrounding this particular point. Joining us live is Dr. Andrew Mulwa, who's the CEC in charge of health services in Makueni County. Daktari, many thanks for your time and your contribution right here on Friday Briefing. Let's begin here. Going by the data from KEMRI, we have approximately 2.6 million Kenyans who are said to have been exposed to the virus. Help us make sense out of this, considering that Kenya has approximately 7,000 confirmed positive cases.
Thank you very much for the opportunity. From the KEMRI research that was published yesterday, it is clear that there are many Kenyans out there who have antibodies against COVID-19, and they themselves are not part of the 7,000 that have been confirmed positive for COVID-19 in the last 4 or 3 months or so. This means that there could be many Kenyans who were exposed to COVID-19 or have been exposed to COVID-19 and developed immunity or antibodies against the disease without developing symptoms. I think this research, because I had an opportunity to look, to flip through the research, about 2,535 samples of blood that is donated by Kenyans was taken and tested for antibodies in our national blood transfusion system in the various regions, the Coast Region, Nairobi, Eastern, Rift, Nyanza, all the regional blood transfusion units. And testing for antibodies for COVID-19, 5% of the samples that were taken tested positive for antibodies against COVID-19. In effect, what this means is that the 5% of this population was exposed to COVID-19 and therefore developed antibodies against the disease.
Still looking at KEMRI's report, is it telling of a possibility of herd immunity? Because we've had this over and over again. Is there a likelihood that some Kenyans could be suffering from the virus and healing unknowingly?
To me, that is one very good news in terms of that more than the 7,000 or so Kenyans that we have been getting as positive for COVID-19 have had exposure to the disease or have developed antibodies to the disease. The one thing that we must accept, because the sample that was taken from blood donors, and blood donors are usually very healthy people. Most of them are usually young people between the ages of 17 and 40, and therefore are people who are active, whose immunity is high, who do not have comorbidities of diabetes, hypertension, and therefore exposure to COVID-19 and failure to develop symptoms is consistent with that age set. And therefore, if the question that we need to ask ourselves from the research is whether the disease actually began in our population in March when we got our first case, or the disease had begun earlier, because even in the European nations we have had people who confirmed that they had symptoms of COVID-19 as early as November, and therefore we could as well ask ourselves, is it possible that this disease came? And therefore, if people have gone through the infection of the disease and developed antibodies, how many people? And to get to herd immunity, of course, it will be, we have to have infection of over 60% of the population. And remember, 2.6% that we are talking about, the 2.6 million is only 5%, and therefore we still have a long way to go in terms of developing herd immunity.
Dr. Mulwa,
if those statistics are anything to go
Dr.
by.
Mulwa, as we look forward, mass testing seems to be a challenge. At least 180,000 samples have been tested so far in more than 3 months. Do we seem to be getting it right or wrong on mass testing?
I think the one thing that all of us must appreciate is that COVID-19 is a global crisis. The supply chain globally has been stretched beyond limits. The reagents that we are using to test COVID-19 are not just required in this country, are required in all the countries of the world. And therefore, we expect that there is a lot of pressure in the production because there is only a limited number of kits that can be produced globally. And therefore, even as we yearn to have mass testing where everyone tests, we may not have the global supply of the test kits, enough global supply of the test kits again. The other issue that we also need to understand is our capacity as a country to test. Currently, there are about 28 or so labs that are able to test for COVID-19 in the country. And this is a really big improvement from 2 labs in March this year. And therefore, as we build the capacity for testing, as we get more supplies for the test kits, then we expect now to stabilize in terms of targeting. But what we have been doing as a country, because we have been doing targeted mass testing, we cannot possibly test everyone walking the streets, but we test people in areas where there is a high risk of infection and people who are at high risk of exposure. And again, for reopening of economy, we are testing hoteliers because they constantly interact with people and they are high risk. We are testing healthcare workers. We are testing people from communities that have been identified as hotspots across the country.
It's good you brought up
truck drivers as well. So
it's good you brought up issues about reopening of the economy, and allow me to interject. President Uhuru Kenyatta is set to address the nation in just days, coming at a time where we've seen Kenya recording cases as high as 300. Quickly, is the country ready for reopening according to you?
I would say the country is ready for a phased reopening because we have, the reason why we went into a near lockdown is to prepare the health system of the country to be able to address upsurge of cases. It was never to stop infections from continuing because the responsibility of stopping infections from spreading is a responsibility of the Kenyan or individual persons. And therefore, what the government has done in those 3 or so months is to prepare the healthcare system to be able to handle cases of COVID-19. I want to use specific example. At the beginning, when we had the first case in this country, our capacity for isolation in this country was below 1,000 beds. Currently, across the 47 counties, our capacity is well over 16,000. And we expect in the next few days or 2 weeks probably, we will have a capacity of over 25,000. That was the exact reason why we wanted these restrictive measures. And therefore, progressive opening of the economy. Where I come from in Makueni, we only had 5 beds at the beginning of March. Now we have well over 320 beds for COVID-19 isolation. We do not have a single ICU facility for COVID-19. We have 5. And therefore, this conversation about preparing the system, we can progressively now start reopening the economy. And now with the introduction of home-based care, we also have another opportunity of managing more cases because this would not have been possible in March.
All right, many thanks. That's Dr. Andrew Mulwa just helping us put this particular issue in perspective, even as we fight to flatten the curve. He's the CEC Health in Makueni County. Well, it's definitely a collective responsibility. All Kenyans do definitely need to play a part. Right, Ashley?
Definitely. Now we want to take a short break here on the Friday briefing. We have much more on the other side.